Now, this is specified pulmonary TB because TB can also occur in the bones, in the joints, and or other body systems. However, the most common site of infection is the pulmonary system. So what is TB? So it's caused by this bacterium here. It's an acid-fast bacillus, grows very slowly. Okay. Because of these characteristics, something that grows really slowly, will it cause acute symptoms if it grows very slowly?
No.
No acute symptoms here. So the patient will develop the disease slowly over several months, over up to a year. So this affects the lung parenchyma, the lung tissue itself, okay, not just the upper airway. It affects the very tissues of your lungs. So it's deep into the airways. Again, the characteristic is it grows very slowly. So for something this small and grows very slowly, is it easy or hard to treat it?
Hard.
Hard. That's why an active infection is treated with 4 types of antibiotics. Okay, there are 4 antibiotics used. There are 2 forms of the disease. There's active, which is if you have active TB, that means you are symptomatic, you have symptoms, you are contagious, right? So who gets TB? Oh, the other type of TB is latent, also called inactive, meaning you're infected, the disease is inside you. However, there are no symptoms because your immune system is pretty good. So you're not symptomatic at all. No symptoms, so therefore you're not contagious either. Again, 2 forms, active TB, the patient has symptoms, the patient is contagious, needs to be treated. There's the inactive form, also called latent TB, L-A-T-E-N-T, wherein the patient has no symptoms. They're infected. However, because there's no symptoms, therefore they are not contagious. The patient, however, with latent or inactive TB has the option to receive treatment if they want to. Okay. If you ask me, why wouldn't you treat it? You're infected, right? Even if though you're not contagious, you're not having symptoms, you are infected. So do you want to treat it or not?
Yes.
Yes. Yeah, why not take the treatment? Okay. So who are at risk? Worldwide phenomenon. So these are the patients at risk. Poverty, malnutrition, overcrowding, because they are closely together, correct? So if the patient is in a poverty economic status, will they have adequate health care? No. So these
No.
always go together. So they're live in poverty, so therefore most of them are malnourished, usually live in overcrowded spaces. Some of them are not even, some of them are even homeless. Okay. Now take note of the overcrowding here. It doesn't have to be in poverty status or malnourished. Overcrowding can be present in what facilities? Where do you see overcrowding?
Jail.
What else? Where else? Very good.
Hospital.
Nursing homes, right?
Shelters.
Yeah. So a long-term care facility, assisted living facilities, so public housing, right? So these are the risk factors for TB. Because how is it spread? Because if it's so tiny, does it drop on the floor or does it linger in the air?
It lingers in the air.
The size is less than 0.5 microns. It's very microscopic, so it travels through the air. That's why what is the precaution we use for TB?
Airborne.
Airborne precautions. Very good. Transmission again is through droplet nuclei because the patient is dealing with a tiny organism, 1 to 5 microns in diameter only. So therefore, talking, coughing, sneezing, laughing, or singing can transmit the organism to the air. So we really need to just be breathing the same air as this infected patient, this patient with active tuberculosis, on a train car, for instance, or in a classroom or in the same house. Right? So what are other airborne diseases besides TB?
COVID.
Actually, COVID is droplet. COVID is much larger than 5 microns. Measles is airborne. Chickenpox is airborne. All right, so those are other examples. You remember how you got chickenpox? Did you touch the individual? You didn't have to. You just needed to be in the same room with them. All right, so that's how you get chickenpox. All right, so here are again, consider this chart as who are at risk, meaning who do you test for TB, and also who are likely to get it, or therefore who, yeah, this thing. So who should you test and who because these are the high risk individuals. So we mentioned a few earlier. So those people with these characteristics here. And who are these people? They are listed here in chart 19-10 as well. So if you live in the same house with someone who's infected, immunocompromised people, so this includes malnourished people, HIV patients, cancer patient, transplant, or those taking steroids, okay? They are all immunocompromised. Substance abuse patients, so especially IV drug use or alcohol abuse. Now, it's not really, this doesn't mean that TB is passed on or transmitted via IV drug use. Okay, this just means that if you're an IV drug user, what's your judgment? I mean, how is your decision making? Is it the best?
No.
Who do you hang out with usually if you're an IV drug user?
Other reviews.
Okay,
IV drugs are-
right. So you're likely to be in overcrowded in less sanitary spaces, right? So that's usually the what accompanies these habits. Any person falling under here, if you have long-term chronic conditions like these, puts you at risk. If you're an immigrant from these countries here. So Asia, that includes China, Philippines, any other country in the Southeast Asian region, African, Latin America, or the Caribbean, right? So if you have traveled or someone from these countries have immigrated in the last 5 years specifically, and I already mentioned these here earlier because there's what's one characteristic between these facilities here.
Crowded.
There's overcrowding, right? There's overcrowded. Yeah. Or if you're a healthcare worker like you and me. So we work in a hospital, you work with specimens, for instance. So you're high risk. So these people, since these are high risk, should we be vaccinated?
Yeah.
Yes,
Yes.
there is a vaccine. It's common. All babies born in these countries here are vaccinated within the first 30 days of life. So during the first month, at some point, the babies are vaccinated against tuberculosis. So it's not bad to vaccinate these patients, these people here as well. Or in our case, in healthcare facilities, what do we get every year? What is a requirement, whether you're in school?
The flu vaccine.
Flu.
No, we're talking about TB. This is a TB chapter.
Quantiferin.
What is quantiferin? I mean,
Check
what's
the antibodies and.
okay, so we are checking for TB. All right. So we are
F1 is F2, isn't it?
so we are required to have tuberculosis testing. So either use the PPD or we use the quantiferin. We'll talk about the test shortly. For airborne precautions, so here are your regulations, chart 19-11. You can read, so I won't read them for you. Just one question. If a patient is admitted for TB and we place them on airborne isolation, what do we need to do if the patient has to leave the room? Let's say they go to MRI, they go to CAT scan, they have TB. What should-
They have to wear
a mask.
okay, what kind of mask?
surgical.
Surgical mask.
Okay, so just a regular mask here. People entering the AFB so should wear regular mask. This is for patients, okay? But what if for staff, for nurses, what should we use?
N95.
N95.
It has to be the N95, particulate respirator. Everybody else not in healthcare, including visitors or the patient, can wear a regular surgical mask. It has to be snug fitting though. It shouldn't be loose. Okay, so let's start with the testing. So what do we actually do? Because we're still using the MAN2 test, we're still using the PPD. So what are we actually looking for?
We have negative. We have to be negative.
So what are we measuring? The redness or the induration?
Induration.
Induration.
Induration is this raised area here. Okay, that is an induration. Even if the redness is involving the entire arm, but there is no induration, is that positive?
No.
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 Only an induration is considered positive. Now, how much induration is considered positive? Okay, let's go here. So first, PPD. So we inject this and we read it twice at 48 hours and 72 hours afterward. Okay, so who is considered positive? Okay, so there are three groups of people